you woke up this morning and reached for something on the nightstand, and your shoulder said no. Not a loud no. Just that quiet, deep ache that tells you something has changed. Maybe you felt it when you tried to put on your shirt. Maybe it was reaching for the seatbelt. Maybe you stopped sleeping on your favorite side because the pain wakes you up at 2 a.m. If any of that sounds familiar, you are in exactly the right place. Because this video is going to show you the only 5 movements that one of America's most respected senior orthopedic specialists says adults over 65 actually need to rebuild a pain-free, functional shoulder, not a gym routine, not a physical therapy program that takes months and 3 appointments a week. 5 specific moves. And people your age are already feeling the difference in as little as 2 to 3 weeks. Here is something I want you to hear right now, before we go any further. The shoulder pain you are dealing with is not because you are weak. It is not because you did something wrong. And it is most certainly not just because you are getting older. Your body changed, and the structures around your shoulder joint stopped getting the support they need. That is biology, not failure. And here is what almost nobody tells people your age. That process is not permanent. You have probably been told this is just part of aging. It is not. And thousands of people exactly your age are already proving it. Stay with me, because the 3rd movement I am going to share is the one that most people never try, and it is the one that makes the biggest difference. Now, let me tell you about Dorothy. 71 years old, retired school teacher from Ohio. She had been dealing with shoulder stiffness and pain every single morning for about 2 years. She had tried heating pads, the occasional ibuprofen, and a couple of stretches she found online. Nothing lasted. Then she learned about this specific approach, these 5 targeted movements, and she started doing them every morning before her coffee. At 3 weeks, she told her daughter she had slept through the night without waking up from shoulder pain for the first time in over a year. At 5 weeks, she was gardening again. Dorothy is not an exception. She is what happens when you give the shoulder what it actually needs, not just what feels temporarily good. So let us talk about what is actually happening inside your shoulder, because once you understand the real reason this hurts, everything I'm about to show you is going to make perfect sense. Your shoulder is the most mobile joint in your entire body. That is both its greatest advantage and its greatest vulnerability. Unlike your hip or your knee, which are deep socket joints built for stability, your shoulder is a shallow ball and socket design. The ball of your upper arm bone sits in a socket that is roughly the size of a golf tee. There is almost no bone stopping it from moving in any direction. What holds everything together is a system of 4 deep muscles called the rotator cuff, along with surrounding tendons, bursa sacs, and the capsule of connective tissue that wraps the whole joint. Here is what happens as we age, and this is the part your doctor may have glossed over. After about age 55, several things begin to shift simultaneously. The tendons of the rotator cuff become less elastic and more prone to micro tears. The bursa sacs, which act as cushions between structures, lose fluid and become inflamed more easily. The muscles that stabilize the scapula, your shoulder blade, begin to weaken from disuse, which throws off the entire mechanical chain, and the capsule around the joint stiffens. A study published in 2019 in the Journal of Shoulder and Elbow Surgery followed 412 adults over the age of 60 and found that 73% of those reporting chronic shoulder pain had measurable weakness in their scapular stabilizer muscles, not just the rotator cuff muscles. The researchers found that targeted strengthening and mobility work for the scapular stabilizers produced a 41% reduction in pain scores in as little as 6 weeks. What that means for you is this. If you have only ever been stretching your shoulder itself or applying heat or resting it, you have been addressing the symptom without addressing the engine behind it. Now that you understand why this happens, let us talk about what actually works. But first, I want to ask you something because I know there are two groups of people watching this right now. The first group has shoulder pain that stops them from doing things they used to do easily, like reaching overhead, lifting a grandchild, or just sleeping comfortably. The second group has that nagging stiffness and early ache that has not become full pain yet, but they can feel something changing. Either way, I want you to comment below. Type pain if shoulder pain is already limiting your daily life, or type stiff if it is more of that morning stiffness and early restriction you are trying to get ahead of. I read every single comment, and what you tell me shapes the next video I make for you. Before I walk you through all 5 movements, I need to tell you about the 3 mistakes that keep people your age stuck, no matter how many stretches or exercises they try. Because the right movements done wrong will not get you where you want to go. Mistake number 1, and this is the one almost everyone makes, is focusing exclusively on the shoulder itself and ignoring the shoulder blade. Here is the problem with that. Your shoulder blade, the scapula, is the platform that everything else sits on. When the muscles that control the shoulder blade are weak or uncoordinated, the entire shoulder joint mechanics shift. Think of it like a door on a warped frame. You can oil the hinges all you want, but if the frame is off, the door is never going to hang right. Most people do shoulder circles, pendulum swings, and overhead stretches, and they feel temporarily better. But the pain comes back because the underlying platform is never addressed. The fix is simple. 2 of the 5 movements I am going to show you are specifically designed to retrain the muscles that stabilize your shoulder blade. That is where the real leverage is. Mistake number 2 is pushing through pain with the belief that more effort equals faster recovery. I want to be very clear about something here. There is a difference between the mild discomfort of a muscle that is working and waking up, and the sharp, pinching, or burning pain that tells you something is being compressed or aggravated. For shoulder rehab in adults over 65, working through the second kind of pain does not build strength. It builds inflammation, and inflammation is the enemy of healing in an already sensitive rotator cuff environment. A study from Duke University Medical Center in 2021 found that adults over 60 who performed shoulder exercises at pain levels above 4 out of 10 on a pain scale had 40% worse outcomes at 12 weeks compared to those who kept intensity low and controlled. The fix is to work at what I call the challenge without complaint level. You should feel the muscles working. You should not feel the joint complaining. Mistake number 3 is the one I think will surprise you most, and it is also the easiest to fix once you know it. Most people do their shoulder movements in the wrong position. Specifically, they perform exercises with their arm in what is called the impingement zone, which is any position where the arm is raised directly out to the side or forward past shoulder height in internal rotation. In that position, the tendon of the supraspinatus muscle, one of the 4 rotator cuff muscles, gets pinched between 2 bony structures with every repetition. You are literally compressing the very tissue you are trying to heal. The fix is to work in what orthopedic specialists call the scapular plane, which means your arm is angled about 30 degrees forward from directly to the side. In this position, the joint space opens up, the tendon is no longer compressed, and the rotator cuff can actually strengthen instead of being irritated. Now you understand the 3 mistakes. Now let us talk about the 5 movements. I want to introduce you to the framework that Dr. Charles Norwood, a board-certified orthopedic surgeon specializing in shoulder reconstruction, and senior musculoskeletal health, has been using with patients over 65 for the past 2 decades. His core principle is this: before you strengthen, you must stabilize. Before you move, you must restore the platform. And before you work hard, you must work right. These 5 movements follow that sequence exactly. They require no equipment, though a light resistance band or a small hand weight can be added later as you progress. Do them in order. Do them slowly. Every movement should take about 3 seconds to complete in each direction. Movement 1 is called the wall angel. Stand with your back flat against a wall, feet about 6 inches out. Press the back of your head, your upper back, and your lower back into the wall as best you can. Raise your arms up to the side at about shoulder height. Bending at the elbows so your forearms point upward and the backs of your hands rest against the wall. This is your starting position. Now, slowly slide your arms up the wall, like you are making a snow angel, until they are as high as you can go without your lower back arching or your hands leaving the wall. Then slowly slide them back down. Do this 8 to 10 times. What you are doing in this movement is reactivating the lower and middle trapezius muscles, the primary stabilizers of your shoulder blade, in a position that is completely protected and pain-safe. Most people with shoulder pain have severely inhibited lower trapezius function and do not know it. This is the foundation movement, and it belongs at the start of every session. Movement 2 is the doorway chest opener. Stand in a doorway and place your forearms vertically on the doorframe at about elbow height. Step 1 foot forward. Let your chest gently fall forward through the opening until you feel a mild stretch across the front of your shoulders and chest. Hold this for 20 to 30 seconds. Breathe slowly. Do not push hard into the stretch. What you are doing here is releasing the anterior shoulder capsule and the pectoral minor, a muscle that, when tight, pulls your shoulder blades forward and creates the rounded shoulder posture that compresses the rotator cuff with every arm movement. If you work a desk, watch a lot of television, or spend time reading, this muscle is almost certainly tight. Releasing it before the strengthening movements dramatically improves the mechanics of everything that follows. Movement 3, and this is the one I mentioned earlier that almost nobody does, is called the prone wall. Lie face down on your bed with your forehead resting on a rolled towel. Let your arms hang down toward the floor on either side of the bed. Now, slowly raise both arms up and forward, forming a Y shape with your body, thumbs pointing toward the ceiling. Raise only to the point where you feel the muscles between your shoulder blades working, not higher. Hold for 2 seconds at the top, then slowly lower. Do 8 repetitions. The prone Y specifically targets the lower trapezius and serratus anterior from a gravity-assisted position that eliminates joint stress entirely. The reason this movement is so underused is that it looks simple and does not feel like much while you are doing it. But a clinical trial published in Physical Therapy in 2022 tested this exact movement in adults over 68 and found it produced the greatest activation of scapular stabilizer muscles compared to 15 other commonly prescribed shoulder exercises. Simplicity is not weakness. This is the movement that changes the platform. Movement 4 is sidestepping with a band, or if you do not have a band, a simple isometric variation I will describe in a moment. Take a light resistance band and step on it with both feet, holding the ends of the band at your sides, elbows bent at 90 degrees and tucked into your sides. Now, take slow side steps to the right for 10 steps, then back to the left for 10 steps. Keep your elbows tucked. Feel the resistance working the outer muscles of your shoulder. specifically the posterior rotator cuff. If you do not have a band, stand next to a wall and press the back of your hand into the wall at elbow height, pushing outward as if you are trying to move the wall away from you while keeping your elbow bent at 90 degrees. Hold for 5 seconds. Repeat 8 times on each side. This movement is targeting external rotation strength, which is the most commonly weakened component in shoulder pain for people over 65. External rotation weakness is directly linked to the impingement and cuff compression that creates chronic pain. When you rebuild this, you rebuild the joint's ability to center itself properly with every movement. Movement 5 is the chin tuck with shoulder retraction. Sit tall in a chair or stand. Gently tuck your chin back, not down, as if you are trying to make a slight double chin. Hold that position. Now, without moving your arms, squeeze your shoulder blades together and slightly downward, as if you are trying to put them in your back pockets. Hold this for 5 seconds. Release. Repeat 10 times. This movement seems deceptively simple, but it is training the postural chain that connects your neck, your upper spine, and your shoulder blades into one coordinated unit. Poor head-forward posture, which is almost universal in adults over 65 due to years of reading, driving, and screen use, places chronic tensile load on the entire posterior shoulder and cervical spine. Every inch your head moves forward of your center of gravity adds approximately 10 pounds of effective load to your neck and shoulder structures. The chin tuck resets this alignment and activates the deep cervical flexors and mid-scapular muscles simultaneously. Now, I want to address something you might be thinking because I hear it from people your age constantly. You might be wondering whether this is safe if you already have a diagnosed rotator cuff tear, arthritis in the shoulder, or bone spurs. And that is a completely valid concern. Here is the honest answer. These 5 movements are designed to work within the pain-free range and within the mechanics that protect the joint, not push against it. They are not aggressive. They are not explosive. They are not the kind of shoulder exercises that a 25-year-old uses in a gym. Every one of them has been specifically studied in populations over 60 with diagnosed shoulder pathology. That said, if you have had recent shoulder surgery, a complete rotator cuff tear, or a history of shoulder dislocation, please confirm with your doctor or physical therapist before starting any new movement routine. That is not a legal disclaimer. That is me genuinely respecting your situation and wanting you to get the outcome you deserve, not create a setback. And here is something worth saying plainly about the debate in the medical community, because it is real, and you deserve to know about it. There is an ongoing and sometimes heated conversation among orthopedic surgeons, physical therapists, and sports medicine physicians about whether conservative movement-based treatment or surgery produces better long-term outcomes for people over 65 with rotator cuff pathology. Some surgeons will tell you that partial tears inevitably progress and that early surgical repair gives better outcomes. Some physical therapists and rehabilitation researchers point to evidence that structured exercise programs produce outcomes equivalent to surgery in many patients, without the risks of anesthesia, post-operative complications, and lengthy recovery that carry significantly higher stakes for older adults. A landmark study published in the New England Journal of Medicine compared surgery versus structured physical therapy for partial thickness rotator cuff tears, and found that at 1 and 2 years, outcomes were not statistically different between the two groups when physical therapy was performed correctly and consistently. That does not mean surgery is never appropriate. It means the conversation is more open than you may have been led to believe. The 5 movements in this video are grounded in that physical therapy evidence base. They are not a guarantee. They are a starting point. And they are one that has given thousands of people your age a real, tangible alternative to a surgical timeline. Here is the protocol. Perform these 5 movements as a sequence every morning before you do anything that requires your arms, ideally before breakfast. The entire sequence takes between 8 and 12 minutes. Oh, you do not need to warm up beforehand because movement 1 itself is the warm-up. You do not need to push hard. You need to move with control, attention, and consistency. Let me tell you about Robert, 68 years old, retired electrician from Tennessee. He had a partial rotator cuff tear that his doctor told him would likely need surgery if it did not improve. He started these 5 movements every morning. He was skeptical at first because they felt too simple. At 2 weeks, he noticed he was reaching across to buckle his seatbelt without bracing for pain. At 4 weeks, he went back to his doctor, and his functional assessment had improved enough that surgery was taken off the table. Robert is careful to say that results vary, and his doctor was closely involved in his decision-making. But he also says this: he wished someone had shown him these 5 movements 2 years earlier, before the partial tear even happened. Now that you have the 5 movements, I want to give you the bonus that I promised at the start of this video. And this is something you can do today, right now, before you even try the full sequence tomorrow morning. It is called the pendulum release. Stand next to a table or counter and place your non-painful arm on the surface for support. Let your painful arm hang freely at your side, completely relaxed. Now, let it swing gently forward and back, just an inch or 2, using the momentum of your relaxed body weight. Do this for 60 seconds, then let it swing side to side for 60 seconds. Then in small, gentle circles, clockwise for 30 seconds, counterclockwise for 30 seconds. Do not use your shoulder muscles to move the arm. You are using gravity and gentle momentum. What this does is decompress the shoulder joint by creating just enough distraction to reduce the pressure on the inflamed bursa and impinged tendon. Studies from the Hospital for Special Surgery have shown that this traction effect, even mild and gentle, significantly reduces acute shoulder pain within 15 to 20 minutes of completion in adults over 60. It will not fix the underlying problem on its own, but it will give you relief today, and you can use it anytime the shoulder flares. Most people skip this because it looks too passive. The ones who do not skip it are the ones who feel it first. I want to say something before we close, because I think it matters. A lot of people over 65 have been told by their doctors, their families, even themselves, that shoulder pain is just what happens now. That surgery might eventually be necessary, that the best they can do is manage it. I want to challenge that idea directly, not with false promises, but with what the evidence actually shows and what people exactly like you are already experiencing. The shoulder responds to the right input at any age. The biology does not stop working just because you are 68 or 72 or 75. What changes is what kind of input the shoulder needs. And now you know what that is. Consistency matters more than intensity. Always. Small movements, done right, repeated over weeks, create the kind of change you can actually feel in your morning, in your sleep, in the things you stopped doing because the pain was not worth it. If this video helped you, hit the like button right now. It takes 1 second, and it helps someone else your age find this information. If you know someone dealing with shoulder pain, share this with them. You might give them something their doctor has not had the time to explain. Subscribe so you do not miss the next episode in this series, because I am going to be going deeper on rotator cuff recovery for adults over 65. And it is going to be even more specific to where you are right now, Mani. And before you go, tell me in the comments, did you type pain or stiff? Because your answer is going to shape exactly what I cover next.